Hi, good evening. This is Congressman Darrell, Issa, and thank you for joining me for this teletown hall meeting. Tonight, the subject is very clearly and appropriately going to be the health care bill that recently passed the House and is now being considered in the Senate.
We've had Medicare for 40-plus years, and I have yet to talk to anyone on it who would give it up or has any serious complaints about it. If that's the case, well, why is the public option such a bad idea?
Is it a good plan? Of course it's a good plan. But is it filled with fraud? Yes. Does it drive up the cost? Yes. Does it undercompensate the hospitals and doctors? Yes. So is it the solution? No. And I'll give you the best example. Canada spends 9% on its health care, and people will say, well, there's rationing and so on. But the amazing thing is more than half the difference between our 18% and their 9% is they have serious tort reform. You can't just sue every doctor for $1 billion if something bad happens. And as a result, their system is inherently not filled with so many procedures just to cover the backside of the doctor. So, am I for health care reform? Absolutely. Do I want to preserve Medicare? Absolutely. Do we need to take $500 billion out of our seniors' money, which is what this bill does? No. And it's one of the complaints I have is that seniors out there that like Medicare Advantage are going to lose it under this. And probably more than anything else, that's where seniors have a right to say this is wrong. We were made a promise, and taking the money out of us without a justification makes no sense.
And we're just, average income, my husband and I. We have a decent health care plan with the company he works for. So should we then expect to have an increase in our taxes, to start paying for this plan immediately? And, and again, we'll be paying that along with, the current medical, fees that we have to pay now for our medical care plan.
Wendy, what really is going to happen is that some people at the top end are going to pay new taxes. For the middle class, what's going to happen is your health care cost itself, including your portion of it, is going to go up in cost. Additionally, what you're going to find is that your plan is going to be scrutinized and you may lose it. And lastly, because the federal government is kicking back to the states a lot of the responsibility for the poor, state budgets are going to be strained, and probably California's income tax is going to be raised again to pay for it.
We have an unemployment rate of over 10% in this country. We're printing money like it's just confetti. We're devaluing everything, and we're nuts and bolting a health care bill that we shouldn't even be talking about at this point. The Republicans need to stand for something. When is someone going to stand up and say, you know what, this is wrong?
Republicans stood up, all but one freshman stood up in unity and voted against this bad bill. Says that just like in the stimulus where we voted 100% against this bad bill, that very clearly Republicans know who they are again, and we're the party of fiscal conservatism.
Why can't we just find insurance companies that will cover those with pre-existing conditions?
That's why I offered a bill, which is dead on arrival with Speaker Pelosi, but that allowed every American to buy into the federal workers plan, the one that I have, which is pretty affordable and doesn't discriminate against pre-existing conditions. Thank you all for joining tonight. Sorry it couldn't go on, all night because I was really enjoying the questions. Good night.